Yeah, my name is Xue Yang, and I'm a community health worker with Juniper. And just to tell you a little bit about myself and where I'm from, so I currently live in Oakdale, Minnesota, with my partner in our small little apartment. And I'm originally from La Crosse, Wisconsin. If you haven't heard of La Crosse, Wisconsin, it's a small, fairly big small town in Wisconsin that's about 50,000 people. And that's where I grew up, and also was raised and finished my undergraduate degree in the community health education program at the university. And that's where a lot of my family and friends are from. But in 2017, I moved up to the Twin Cities to explore more opportunities up here. And right now, in 2019, I was able to get a job at Trellis. And we used to be known as the Metropolitan Area Agency on Aging. And I know that's a mouthful right there. So we did change our name to reflect the services that we offer. And our mission here is to assist individuals to age well and develop capacity of communities to care for the aging population. And Juniper, talking about Juniper, is a program under Trellis. And a little bit, I'm going to talk about Juniper, what we do, and also how my role ties into the Juniper programs. So Juniper, maybe not a lot of people may have heard what Juniper is, know Juniper is, but we are an organization that work with other organizations and healthcare systems to offer evidence-based health promotion classes throughout Minnesota. And when I mean evidence-based, what does evidence-based mean, right? Evidence-based means that there's classes such as exercise-based classes, movement-based, balance and falls prevention, classes that help with managing chronic conditions. These are studies that have been proven to be effective in helping people and bring value and benefit to their lives. And so the Juniper programs, we partner with community-based organizations all throughout Minnesota and healthcare systems. And when I say community-based, these could be community organizations that are providing services to the Hmong community, other diverse populations, so providing housing services, food support, and transportation. And so we do partner with communities throughout Minnesota because we want this to be impactful, and there's already a foundation of trust already within those communities. And so we are not just bringing classes, but we're providing these classes as an educational way for leaders to teach their community members to be able to build advocacy and also self-efficacy and learning about different ways to manage their health and just being healthier. And so that's a little bit about the Juniper programs, of what Juniper is. In terms of the classes that we offer here, Juniper classes, there's broken down to 3 categories, and I'll briefly go over them and just sharing with everyone what the classes entail. And so we do offer 13 programs. So we do offer exercise-based classes. And these classes, when we think about the Hmong community, we think about, number one, exercise for older adults, grandparents and mothers. It doesn't matter what they, right? Number one, exercise, because that's what they grew up with. Everything, I know that for me personally, my mom, she does a lot of farmers market during the summertime, and her way of exercising is because that's what they learned in Laos. And so aside from that, during the times when during the warm weathers is not available, or if someone is just not mobile enough to get outside and go do other activities such as walking, or it's not safe to do any of those activities, there are classes that we are offering in the community-based organizations. And also we've been able to adapt classes online, knowing that can be a barrier in itself with accessing technology and having the support needed from family members to access these services. But we can talk a little bit more about that, about the barriers in a bit. But in terms of classes, that's one way for the aging population, the Hmong community, grandparents, older adults to access. And these classes help participants be able, anyone, whether you have full mobility or you just want to get a little movement, just a fun way to get active, focusing on yourself and your health, working on strength, building strength, balance. And we know that a lot of our older adults and everyone, our culture involves being social, getting outside, connecting with family and friends. And that's what these classes are, done in a community setting for the community so that you can gather and socialize. And we've been able to see a lot of that, especially during the pandemic. People are isolated, they feel alone, and they just needed someone to talk to. And so these classes is a way to gather people, from all over, whether you're in the Arrowhead region or you're in, the western part of Minnesota or the Twin Cities, you're able to access these classes. And then the other areas of focus that we also focus on is falls prevention. For example, one of the programs that that's fairly popular is the Tai Chi Chuan Moving for Better Balance program. And this is a class that was actually developed and designed by Dr. Fujong Lee, and he utilizes traditional Tai Chi movements to help with falls prevention. And it's a total of 24 sessions that helps participants be able to get moving, learn about different ways to move, and focusing on stability to instability, and doing very gentle, base, slow movements. But they can also be very challenging in itself too, but also really fun. That's what we emphasize. Lastly, the classes that we also focus on is living well, because we know that, especially in the Hmong community, a lot of the things that we see here is diabetes, chronic kidney disease, gout, high blood pressure, high cholesterol. And we do have classes to help the community to be able to learn about ways to manage chronic conditions, or if it's diabetes, we do have those who are diagnosed with type 2 diabetes, but may not have the education or may not have the necessary resources or communication with the provider to be able to manage their diabetes, such as when your high blood sugar is high, or when slow, or communicating with family and friends that, hey, I need support in this area. And so we do have classes that are able to help support community members to be able to get the support they need. And so also I want to highlight is, knowing that with those chronic conditions, there may be caregivers as well. And we do have classes that focus on caregivers. And this class is called the Powerful Tools for Caregivers. Myself, I know what it means to be a caregiver too. I used to take care of my dad. He had chronic kidney disease, diabetes, high blood pressure, managing and taking so many different types of medications. And myself as a caregiver, I was going full-time to school during that time, having to be the ideal son, having to balance my life, and I know how stressful it is going full-time school, and sometimes I felt really isolated and like nobody was listening to me. And so these classes is a way to connect also caregivers together, and knowing that, hey, I'm not the only one who's going through this. And this is a way to support you and learn to focus on yourself. Because I know that sometimes it is difficult when you have to be selfless, right? It's hard to be selfish, especially when you're caring for people you love, because you want to be that strong front that they can rely on. But we also have to remember that we have to love ourselves, take care of ourselves. And these classes is a way to learn different also ways to manage our stresses, our difficult emotions that come with it. And in order to take care of the people we love, we have to come back to where it starts. So, if anybody does want to learn a little bit more about what's available, our staff, we get time to know the person, understand what they need, because everyone is different. Some people, they might be managing multiple chronic conditions at the same time. I'm not really sure where to ask for help. And so our teammates, we do take time to listen, provide education on what classes might be a good fit, and working with every individual. How do we also tackle all the other social determinants of health needs, social economic factors that play a role into our health? And so my role is also not also talking about the Juniper programs, but also really looking at the person as a whole. Some provider that might be working with a patient, they might feel like this person is not following their health plan, right? But that not might be the case, because we look at the person as a whole and we say, well, it sounds like from what you're sharing with me, you really want to focus on your diabetes, but you got to put food on the table. You got to figure out how to get to work, transportation. You got to get help for looking for a new job, and so that might be what's the biggest worries, and our job, my job as a community health worker, is to be able to use client-centered approach, listening skills, to really understand the person and what I can do, taking small steps, helping this person achieve those many small wins. And then eventually, we can talk about the big picture here, what the provider wants the patient to focus on. What I hope to see in the future that's going to require is that, especially for the Hmong community, me being Hmong, I speak Hmong, I eat Hmong food, I love eating pho, different, all the food that has to offer. But one of my passion is also I'm also a leader in the classes here, Tai Chi, living well chronic conditions and chronic pain. But when I teach a class, I see predominantly one specific group, predominantly white, speaks English, and I always reflect, what's happening. How can I also offer it to underserved populations, to my own community, and how can we make these classes also really culturally inclusive, appropriate for our Hmong community, but also BIPOC communities. How do we work together to offer these classes? And one hope for the future, for me is being able to work with other organizations and other Hmong leaders, people who are passionate about offering classes. And because I could teach a class, but I wish I could clone myself and teach classes all throughout the community, but it's also going to require a lot from the communities, people who are invested in the communities and be willing to also partner with us as providers or leaders offering classes to the Hmong community. And why am I doing this, right? What drives me to do what I do every day, waking up, and continue the work that I do? As someone, a family of refugee who came from the Vietnam War, and just my parents trying to escape the horrific things and tragic things, coming to America for a better future for their kids, right? I just can't imagine what they were going through that time. And, when I think about, during that time, and it was probably the survival factor, right? We need to survive, get our kids here for a better future. And I think about, I don't think they even think about how aging is going to look like when they're here. They were just here, getting here, what next, right? And growing up, in a poor family, we grew up poor. We used to access a lot of the food banks. Sometimes it felt kind of defeating, but that's what we did to survive. My mom worked 3 different jobs, just trying to get by, just trying to put food on the table. And I saw a lot of the bad side things, or like just really harsh things. Grew up having to work my way up, having to really not be able to understand. I might not be able to understand everything my mom went through, but just seeing from a kid's eye viewpoint, it really just helped me with my work ethics, and her story, because I feel like sometimes she doesn't have a voice, right? Especially a woman, person of color, that's in this world, this new world that, she has no idea, what, how to survive. And so my passion really stems from her. She drives me, she makes me, also just make me become a better person. And so, my passion lies within that, and also being able to use what I use, my platform, as a power to really be an advocate for the community, and being the voice, but also what's important is passing the mic when it's needed. And so that's what drives me to do what I do. A lot of my past, my future, my present, people that really played a big role in my impact, making me just feel like I want to do something to help the community give back. And so that's what I'm using my role as an advocate, as a community health worker, really to bridge the gaps.